I want to move on now to adolescents because we had been doing work in the diabetes population for some time, and we were continually prompted to do work with adolescents. This is a very difficult group with type 1 diabetes. They are transitioning from a period where they're totally dependent on their parents to becoming independent and having to care for themselves. And this is actually a time where you start seeing their hemoglobin A1Cs start increasing as they become non-adherent to the therapy. They are not taking their measurements on a regular basis. They're not adjusting their insulin. They're not eating properly. They're learning things about things like liquor, right? And this causes havoc with someone with type 1 diabetes. So we wanted to start again, and we wanted to start on a new platform. We wanted to take everything that we've learned in the previous 4 or 5 years and start applying it to a new platform, and we chose the iPhone this time. And when we looked at the App Store, we saw lots of diabetes applications already on the market, right? So we had a look at them, and most of them were just electronic versions of their paper counterparts. So most people with diabetes have this logbook of some sort. Sometimes it's a little booklet, and they log all this. And these applications were really just electronic versions of those, and we really didn't believe that the use of an electronic logging tool would improve health outcomes, because that is, in the end, our outcomes. We're looking at health outcomes here, not just a gadget that makes the patient happy or makes the clinician happy, but we're looking at health outcomes. Can it improve health outcomes? So working with sick kids, we developed this application for bant. And bant is new. It's already available on the App Store, and we went for simplicity on this. One of the biggest things that we heard from these kids is that it has to be fast, especially at school, at lunch, when they really don't want to take that lunch measurement. So this, in our first iteration, this is what it looked like, and you can see how quickly, okay, well, let me start by what the app is. And the app is mobile, right, number one. It encourages active self-monitoring, right, so we want them to take their measurements. The other criteria is this notion of teachable moments. And this was something that the endocrinologists at Sick Kids really wanted, is the ability to sort of peer over the child's shoulder and be able to say, wow, you just got your 3rd high breakfast reading in a row. What are you going to do about it? And again, it's important for that to happen in the context of the reading at the time they took it, and not 2 to 3 months later at their clinic visit. So they want to provide that teachable moment within the application. As well, we have a means of communicating between parents and providers with the patient within the application. This is a very volatile time during adolescence. As many of you know, I have an adolescent. I'm sure a few of you have an adolescent, and the communication is probably at a higher decibel level than when they were children. And it's even worse with kids who have type 1 diabetes. And so we're hoping that by sort of, in some cases, just putting a buffer between the parent and the child through a communication channel, an electronic communication channel, it will perhaps improve the communication between them. We also want to create a community, a social community within the application, because many of the type 1 diabetics that we interviewed have never met anyone else with type 1 diabetes, despite its prevalence. Even in a school of 1,000 children, they may not have met another, there may be one other person with diabetes in that school. And they probably don't know each other, and they probably don't want to know each other in the context of their condition. So by gathering them and putting them in their own social community, perhaps that would make the application a little stickier. And also, in the end, we want to try out how we can elicit positive health behaviors through the use of rewards, and I'll talk more about that. So again, bant has been available for now a year on the App Store, and this is the version 1, which is entirely manual entry. And we wanted to make sure that this application was fast, very fast in being able to do data entry. So this is what it looks like. And you can see how quickly you can take a context, slide it down, and dial in your reading, and you're done. That's how quickly you can enter a blood sugar reading. Then you can go in and annotate it as well. And so this was a criteria for us, that this had to be blazing fast and simple to use, and you can then go ahead and review your results in context. And you can also see an analysis of your 14 days and your 21-day trends, what's in, what's out of range for each context. So what else did we add? We added this sharing capability, and this sharing capability is almost like Twitter, right? It's a microblogging feature where they can communicate with each other and separate the communications between parents, peers, and providers and make sure that they don't mix, right? And this notion of social networking and diabetes is not new. This is not something that we're first to try. The Twitter community, the diabetes community within Twitter is very active. And you can see them on a regular basis. They identify themselves with the blue circle in their avatar. Many people with diabetes identify themselves as such. And they openly talk about their condition on Twitter. And you can see the hashtags that they use. They use the hashtag diabetes, but they also use the hashtag BGNow. And that represents blood glucose now, and they're just tweeting their blood sugar and sharing. And it's a very active community, and we believe that there's literally tens of thousands of people who are doing this, and it's a very large open social community. The other thing that we were very cognizant about is that we didn't want to create another information silo in all of this. So we support both Google Health and Microsoft Health Vault, and it's the first application of its kind on the App Store that supports both Google Health and Microsoft Health Vault PHRs. So the data isn't stranded. It will always be there. It can be leveraged into other EHR EMR products. So both Google Health and Microsoft Health Vault, social networking via the diabetes community on Twitter. The other thing we did was localization. This was a bit of an afterthought, but we're glad we did it. We have it localized now in 10 languages. And why this was important, let me just go back, is that we've had about 26,000 people download this. And about a disproportionate number of them were from Korea. And why? Because there are no Korean diabetes app in their app store. There were only English apps in the app store. So the fact that we had a huge number from Korea was very encouraging, and that this is a global problem, and this localization thing is very important. So Dr. Jay Parkinson, who's a physician and blogger about health technology, said very kind words for BANT in terms of its design and simplifying health, and that's in fact what we're trying to do. Is we're not trying to add complexity by adding technology. We're actually trying to simplify their lives with the use of technology. Henrik Bergen, another diabetes blogger, called it a glimpse into the future of diabetes care, and we're very proud to now move it on to the clinical trial stage with sick kids. Now, version 2 is far more advanced. It has the teachable moments component to it. It has the connectivity directly with the device, because we did not want self-reported data with these adolescents, because we had a feeling they might try to game the system, right? So the data can only be entered through the meter, right? And perhaps some of them could game the system by getting their friends to take their measurements for them, but that must be a really good friend, right? Right, and it's probably not sustainable. So we had a wired version and a wireless version now, and we ended up going with this modified, and again, this is technology that we developed to get the data out of the glucometer and over onto the iPod, iPhone, or iPad. And this is what it looks like. So again, this is the first example of a medical device communicating with an iPhone. So huge roadblock, much simpler to do on the BlackBerry, I might add, but Apple, in the end, was very responsive, and we were able to do this. So this communicates over Bluetooth, and you can see that it will automatically, once they pull the strip, it will evoke the Bluetooth signal, it will automatically turn the Bluetooth on, BANT will launch automatically, and the data transfers. So it's all there, and the community and so on. So we've now, the trial has been running now for 7 weeks. We have another 5 weeks to go, and this is just a clinical pilot. We want to work out any issues we have before going into a randomized control trial, which we hope to start by year end. And this is some shots from the community, and we were very curious to see what the kids were talking about. And perhaps not surprisingly, they don't talk about diabetes at all in the community. They talk about their iPhones, they talk about apps, they talk about music. On occasion, they talk about some event that Sick Kids is putting on for diabetes, but generally they stay off that topic. And in the end, we don't care as long as it makes the application sticky. It's something that they return to on a regular basis. So finally, we wanted to do rewards, right, as an adherence mechanism. So with the adults, we had these automated phone calls that went to their home phone and would annoy them, but in the end they would adhere. We were pretty sure that wasn't going to work with adolescents. So despite the fact that Sick Kids has a terrific number of behavioral scientists there who know the teenage adolescent mind, we said, well, what could we do, right? And interestingly enough, they said, well, you just can bribe them, right? And so that's what the rewards are. And the rewards come in the form of iTunes redemption codes so that they can, right from the application, within the application, be able to buy music, buy apps. So here's an example. This was live off our server, and you can see them, one person getting Angry Birds, the other one's getting Night Vision Picture and Video Spy Toolbox Pro. Whatever they want, and it's surprisingly lots of music. And I just thought kids had a different view of the intellectual property around music, but a lot of them actually use it for music and not for the apps. So that was a pleasant surprise as well. So some might say, well, how sustainable is this? This actually costs money. Well, it's not actually costing all that much money. I think for someone who's perfectly adherent, we're spending about $3 to $4 a week on iTunes redemption codes, so it's not a lot, especially when they're spending about twice that much on strips per day as well. And whether or not there's other mechanisms, and we're going to try this in the adult type 2 diabetes population. And we're changing it from iTunes to Air Miles. So Paul Ritvo, my collaborator from York University, is working on this with the BlackBerries and using Air Miles. But, again, we're thinking about the long-term sustainability of this. How do we scale this into the tens of thousands, hundreds of thousands of patients, right? It may not be practical to have this, and I can almost hear the policymakers trying to justify iTunes and Air Miles. So what we believe and what we'd like to try in the future is in fact virtual gifts, because what we know from social game theory, as many of you know, because I know someone is out there harvesting for artichokes, right, is that this is just as compelling as tangible rewards. This is just as important to individuals. This will create behaviors that will bring them back on a daily basis in order to get that reward. I can't explain it, but it's real. Right? In fact, people will actually pay for the artichoke when they can't get it, right? Right? So can we use this mechanism of social gaming, which we've started with iTunes, and continue it with these virtual gifts to elicit positive health behaviors? So that's the next step. A lot of people asked us where we got the name BANT, and it is a tip of the hat to our heritage, right? We sometimes forget the significance of the discovery of Frederick Banting almost 90 years ago, right? So BANT is a play on the word banting. And it also teaches the kids a bit of heritage and where they would be otherwise without the discovery of insulin. I need to thank lots of funding organizations over the last few years that have supported our research, including NSERC, Heart and Stroke, InfoWay, St. Elizabeth, who funded BANT, which was a very high-risk project. St. Elizabeth is a vanguard in this area. Thank you to St. Elizabeth and the ministry as well. And lots of help from companies, like-minded companies who believe that this is sort of the future of healthcare. I need to thank the center, a great group of people on the fourth floor of our Fraser Elliott, a terrific bunch of people. This is how we're organized. These are the two specific groups that helped do this research, the Medical Device Informatics Group and the Healthcare Human Factors Group. and I appreciate these people a lot because they could go off and do a Twitter application or work for Facebook, but they choose to work here for patients, and I'm greatly appreciative of that. I also really need to send a word out to the Human Factors group. Largely, I consider this as our secret weapon up at the center. They've grown now over the last few years to become the largest group of their kind. They hold our feet to the fire every single day to make things simpler and logical and better. They are our biggest critics, and they make mediocre things good and good things great through the scrutiny that they provide and making sure that we stick to user-centered principles. And their success is blossoming and is representative by the number of clients that they have around the world. So a great deal of thanks, because these interventions would not be the same without the Human Factors group. So thank you, and I'm happy to take questions.